am going to be flying solo today. Today is going to be a special discussion because we are entering into the week known as National Health Education Week. And as a registered dietitian, health education is definitely something that I am extremely passionate about. You may remember a handful of episodes ago, I put together a discussion around the politics of health care and education. And now I'm kind of picking up a little bit where I left off there because I find this to be one of the most powerful tools that we have to make informed decisions about not just what we eat, but also how we can live, especially when it comes to managing our own health and chronic conditions. So in today's episode, I'm going to be talking about the role of health education as it relates to food and nutrition and how it can help us with making better decisions about our health and why this knowledge is so important because I'm going to keep saying this, especially at the time of this recording. We're heading into a major election here in the United States, and it is very important to understand not just your concerns, but also who you're voting for, what they are voting for and against, and just being a little bit more educated about the different platforms that are available for you to understand. So let's dive into health education, its role as far as empowering individuals to take control of their well-being, with a little caveat, because this is all related into the discussion around elections too, is, I've said before in these conversations and when I've interviewed my guests as well, there's something called healthism. Healthism is the unfortunate, incorrect understanding that individuals should be responsible for their own health and wellness or their health outcomes, and that is not always the case. We are not supposed to be putting the direct responsibility solely on the individual when there are so many other things that play a role, the different factors that play a role in helping us make our choices. So we'll talk a little bit about how different foods can impact our health, how we can improve our energy levels, how we can consider preventing and managing diseases like diabetes and heart disease, and also the multifactorial approach of supporting our overall mental and emotional well-being too, because all of that is interrelated when it comes to environmental and behavioral discussions. So again, I'm acknowledging healthism, that it's not always our responsibility, but I'm also wanting to share information with you to empower you and to advocate for you to make better decisions and to speak to the powers that be that some of these things are related to as well. People who are in charge need to help you out so you can help yourself. Okay, so one of the core pillars of health education is teaching people how to build a healthy diet, meals. And this starts with understanding a few foundational concepts. Now, I've gone through in some of my past wellness webinars, so I won't reiterate a lot of stuff here in this podcast. And I've also done some previous standalone episodes about meal planning, meal preparation, mindful eating. So you're going to have, I probably will include some links to some of those here in this episode so you can go find other resources that I've put together for you. But I'll just give you in a nutshell about what we talk about balancing our diet, right? Balance of things, having a wide variety and diversifying our diet provides us with, hopefully, all of the nutrients that we need. We're talking about macronutrients, carbs and fats and proteins. Those are the things that provide you with your calories to give you the energy, to get you off and running, to keep you focused throughout the day. And it also provides us with the micronutrients because not every food has everything that our body needs when it comes to vitamins and minerals. So when we know how to create meals around those macro and micronutrients, we can then provide us with the fuel that we need and the substance that we need to be able to have our bodies function more effectively. So it's not about cutting out food groups. I know this is a big thing with a lot of you out there, right? Anti-carbs, I'm talking to you. But it's about not restricting and not depriving yourselves. And obviously, if you have access to quality, nutritional, affordable foods, then hopefully you can play a larger role in that. If you cannot access certain foods, then none of what I'm talking about matters. So I would love for you to reach out to me, info@dishwithdina.com. Share with me a little bit about your insights and concerns, or find me on social media at dishwithdina. And let's see if I can help you with some of the resources that you might need to help you put together some of these balanced diets. All right, next thing is food labels. Boy, do I have a ton of resources about this too. So again, you can go into a little deeper into the archives of my YouTube channel or some of the discussions that I've had with our wellness webinars and our previous guests. When you are picking up food that has a label on it, it's always important to see behind it what's in it. So again, not going too deep into discussion, otherwise this episode will be 2.5 hours long. But we're going to talk about reading food labels from top to bottom. You have information that shares with you the carbs, the fats, the proteins, the calories that are in something. And then you also have towards the bottom, the area that lists out all of the ingredients. So some of these things, like the skill of reading a label is really important because it can empower you to make better choices for yourself, especially if you are managing some chronic condition where you might have to limit or avoid things like cholesterol and salt and added sugars. And I will also say the food manufacturers know how to entice you because it's very easy to be misled by some marketing tactics. So being a savvy shopper is really where it's at. Understanding again, carbs and fats and proteins are your macros. Those are going to combine and equal the number of calories that are in a food. As a general rule, I always like to say about 100 calories equals about an hour's worth of energy for you. So if you are making food either from scratch at home or you are preparing meals for yourself based on a variety of different purchased items, things with labels on them, what we call processed foods or packaged goods, then take a look at all of the stuff that you're creating for yourself and consider about how long that should keep you full before you have to eat again. So if you're making something like a 400 or 500 calorie meal, ideally, if it's a good combination of macronutrients, carbs and fats and proteins, or it can keep you full, it can keep you satisfied, and it can keep you energized in the sense of it has enough calories for you, then that should potentially keep you satiated and feeling good to go for about 4 to 5 hours or so before you feel the need to eat again, or maybe stop and have a snack before your next meal comes. Portions discussion as well. So here's another big thing too. In diet culture, portion control is a big thing. So that means if you are focused on restricting your diet, which you know me, I don't love that when people do that, then you might end up saying, I don't deserve or I shouldn't eat this amount of food because I'm only allowed to have a cup of this or half a cup of that or 2 tablespoons of whatever. And to that, I say it depends, as things always depend in the world of dietetics and nutrition, because if you are adjusting and balancing your diet, and as I said too, with the kind of 100 calorie per hour rule, you might be really hungry right now. So if you're only getting yourself a little snack bag of 100 calories worth of whatever this particular food item is, and you're not eating again for another 6 to 7 hours, I'm going to say you might have to double up on some of that stuff, my friend. And similarly, alternately, if you are adjusting your macronutrients in a way that you are reducing or limiting some of the more grain-based foods, not all carbohydrates, but specifically say you're taking away some grain-based foods like rice or pasta, then you're also taking away calories. So you might have to double up on things like your protein or your healthy fats to be able to satisfy you and give you enough calories to continue moving. So portion control in that respect is really identifying what it is that helps you fuel up, feel good. It can also prevent you from overeating and supporting your overall needs moving forward, whether you're managing your own diet, your conditions, chronic conditions, or just your schedule too. So we can definitely talk a little bit more about that if you work with me or any registered dietitian, we can create for you some customized meal plan strategies to make sure that we are satisfying not just your hunger cues and fullness cues, but also just what your body needs. And here again, I'm always stepping aside on my tangents. Apologies. Here is also where I want to distinguish that not everybody can recognize hunger and fullness cues, depending on if you have disordered eating patterns, or you're recovering from an illness or an injury, or in the senior population, sometimes just by nature, our gut and our brain don't really talk to each other very well, or you might be having to manage multiple chronic conditions, and maybe you are on multiple pharmaceuticals that can affect the way that your body knocks and tells you that it's hungry or tells you that it's full. So sometimes I find that a better way to create a more balanced way of eating or structured way of eating is set a timer for yourself. And here's where portion can come into play as well. So say every 3 to 4 hours, you're just saying, I need to eat something. So maybe you have part one of a meal and then part two of a meal. half of a portion then, and the other half of a portion a few hours later. Allow yourself to digest and move around, and then go for seconds. So it's okay that sometimes it's going to be a little bit more, or maybe sometimes it'll be a little bit less, depending on what your needs are. And hopefully that can help you strategize for, again, an individualized approach on how your body can best perform with the food that you're given it. Okay, nutritional needs across life stages. So again, I'm educating you on some of this information, this health education, understanding that our needs change over time. It depends on if you are pregnant or if you're going through puberty, or like I said, if you are in the senior population where things are just naturally maybe slowing down a little bit for you. And if you are in sports or anything else that might take you outside of a quote unquote typical life stage, we have to accommodate that too. We also have some clinical conditions that could potentially make you either need additional calories, like people who have respiratory conditions sometimes need extra calories to offset the way that their body is converting energy from food. And then we also have some conditions that we might need to have less calories because maybe there's some mobility issues, so you're not able to move around a lot. So again, these are things that would be specific to your own needs, and it's important to understand that with your healthcare provider, but also with your dietitian when you're talking to them about how to adapt your specific diet to meet the needs of either your body through the life cycle or addressing any potential conditions or concerns that you might have. All right, now health education obviously so valuable. We need to also acknowledge that not everyone has equal access to it. I just mentioned that before, and I say it all the time in a lot of these episodes, that we have something called the social determinants of health, the SDOH. So this involves socioeconomic status, cultural barriers, lack of resources. These things often prevent people from accessing the information that they need to make informed decisions, and also accessing the things that they need to bring into their life to be able to live and have quality of life. Public health initiatives are crucial in that, in improving access to things like education, as an example, in underserved communities. So if you're listening to this and wondering, how do I empower myself? Here are a few ideas. Aside from just reaching out to me, listen, my DMs are always open, but I do get flooded a lot. So I'm going to share with you some guidance and some resources here. All right, number one, reliable resources or sources of information like humans in your healthcare system, registered dietitians, also public health professionals, also trustworthy health websites. Okay, not Google. Don't be looking up some random thing on a blog. No offense. I write blogs too. And yes, I vet them when I have resources and research that backs up a lot of what I write. But you can't always believe everything that's out there that people are throwing onto the internet. So please be sure it's either a .gov site or a .org site, or you know it to be like the Mayo Clinic or something from Harvard Health. Okay, those would be more legitimate health websites. So please just be really, really careful when you're looking stuff up on the internet. The next thing is taking part in community health programs, which often can offer free or low-cost nutrition education. So here in New York City, we have Grow NYC. They do farmers markets, they do nutrition education, they have the food vendor stands, and depending on, what community, neighborhood you live in, I'm sure across the United States, there's something similar to this. Maybe it's a community center or a government office that offers things like this that you can go to, or maybe even your library. You can check in some of those things too that offer your community health programs. Number three, stay curious, explore new foods, check out new recipes, venture out and try some different cooking methods, expand your knowledge just around the flavor profiles and experiences that you can have. And not all of these have to be super expensive. Sometimes there are potluck picnics that people invite you to, block party things, or you have, open streets where they have maybe street fairs, and you can go check things out for a couple of bucks and see and open up your palate towards that. Okay, next up is public health and how it relates to the upcoming election. I know, I'm sorry. I like having uncomfortable but necessary conversations. I'm not going to force too much down your throat. No food pun intended. But with any election coming up, not just this big one in the United States right now, but with any election coming up, I do want to talk about how public health is connected to politics, right? And if you heard the other episode, I'm going to just reiterate what I said there too. So, health education, nutrition programs, access to healthy food, Also, food policy and programs and manufacturers and all these different things that are placed upon people who help us get our food from point A to point B or point Z. These are issues that are all influenced by policies and the people that we elect into office. So, whether it's funding for a public health initiative, whether it's school nutrition programs, whether it's healthcare reform, and your girl here, who has been involved for the last 8 years in seeing patients through healthcare insurance or health insurance plans, I should say, and understanding how reimbursement works, whew, we have a lot to hopefully improve upon. I don't know if it's ever going to happen, but hopefully in some of our future advancements, we'll see some healthcare reform. Our elected officials really do have a significant say in shaping the landscape of our health in our communities. So, how does this tie into voting? Well, before heading to the polls, you probably, especially if you're listening to this live during the October, November time frame, you're probably getting inundated, bombarded from social media, especially about how to set up yourself for success when you're going to your polls. It's important to know where your local and national candidate stands on public health issues. Have they supported funding for health education programs? Have they voted for or against policies that make healthy foods more accessible? What is their stance on healthcare coverage, particularly for those people with chronic diseases who rely, in my world, on nutrition counseling and support? These things are all tied in to how to vote for your person on the ballot, or even sometimes the proposed programs on the ballot as well, these proposals and these proposed measures. So you can go, I'm going to link some things on here that you can go to and get yourself set up to be better informed for voting. Or if not for this election season, then maybe something else that is related to something a little bit more local in your community.